program for many years. I think that this webinar will really be a big help to either one of you guys. So if you have questions, you can write them in the side section in the Q&A section, and we're going to try to proactively be answering those questions as we go on with this webinar. So let's get started. So as I just mentioned, please, we're here to not only advise you guys about what's happening with the program, but we want this to also be interactive. So please, ask any questions that you may have. There are some big changes happening in CDPAP. So it's something that we want to make sure that you guys are aware of. So,
sorry, Joe, I'm just going to interject.
Yes.
Sorry, I was going to interject. If everyone can enter their questions or comments into the chat section, because I'm having trouble responding to everyone in the Q&A. So if you go to the chat section, put your questions there, and as Joe's going through the PowerPoint, I'll be responding to everyone's questions.
Thanks, Megan. So the CDPAP, right? What does it stand for? It's Consumer-Directed Personal Assistance Program, and it's for those individuals that are chronically ill or physically disabled, and if they need assistance with personal care, home health, or nursing level of service, they actually have the ability to hire, recruit, train, schedule, supervise the caretakers called personal assistants, and those personal assistants are allowed to be family members, friends, or individuals from the community. And this program, a lot of New Yorkers take a lot of pride in it, because it was started in New York by those that are disabled, for those that are disabled. And that's what really makes this program unique. And it started in New York, and it's since this consumer-directed model has spread to other states throughout the U.S.
Right, and to piggyback onto Joe's point, this program was created by individuals with disabilities, for individuals with disabilities who really wanted more independence and autonomy, and really the ability to thrive in their own home rather than going to an assisted living or a nursing home. And it was started in the 80s. But it seems like the CDPAP program, the Consumer-Directed Personal Assistance Program, really hasn't gained much traction. A lot of New Yorkers don't even know that it's an option for them for home care. So that's where Joe and I come in. We just like to spread the word that is CDPAP to New Yorkers, let them know that it's an option for them, because CDPAP will be good and will be a good option for some people and maybe not others who don't really want that kind of responsibility. But it's definitely important to know the different options that you have when it comes to home care. Exactly.
And before we take a deep dive, let's take a look at some of the terms. So CDPAP, Consumer-Directed Personal Assistance Program, that refers to the program itself. It's also referred to sometimes as CDPAS, which refers to the services that are within the program. Now, when it comes to the individual that's receiving the services, that's called the consumer. And the consumer is that individual who manages the program, right? They're able to, instead of the agency being the one that directs the care, it's the consumer. And they can either be self-directing, which means that they can make decisions, know the consequences of those decisions, and they're able, like I said, to manage the program. Or if they're not able to do so, they can have a designated representative, right? So for a senior, that representative may be the son or daughter. It doesn't have to be a family member. It can be a neighbor. Or for a child, let's say it's a child that's medically fragile, or a child that has autism. It can be the parents. So you have the consumer, that's the individual that's receiving the services. You have the designated representative, for those consumers that aren't able to manage the care. Next, the individual that is assisting the consumer under the consumer or designated representative's direction is called a personal assistant. And Premier Home Healthcare, that is considered a fiscal intermediary. And there's over 600 of them in New York State. They're the entity that is the intermediary between Medicaid and the personal assistants when it comes to paying them. And we handle the wage and the benefit processing, and also help with the consumer with their responsibilities.
So now that you're seeing these definitions, you may be thinking, what is it that Premier does as an FI if the consumer, who is really in charge of this program, is in charge of recruiting their personal assistants, screening, interviewing, hiring, training, supervising? What is it that Premier and other FIs do? So what we do is our sole responsibility is to process the payroll and the benefits for the caregivers so that the caregivers are happy and they remain on service, as well as assist with the enrollment process. And that way the consumer can solely focus on directing their services and coordinating the schedule, things like that. You can think of it like this. We handle the back-end process. We're really the administrative component, whereas the consumer is the director of their own services.
Yeah, and we try to be that support for the consumer. As Megan mentioned, we do all the paperwork in the background, and also paying, which is really our main responsibility. Now, for somebody to be eligible for CDPAP, who determines that? It's actually the Department of Social Services if the individual is straight Medicaid, or it's the Medicaid managed care plan if the individual is in a plan, right? So, and when I say straight Medicaid, those are individuals that are not in Medicaid managed care organization. Those are the individuals that are considered straight Medicaid and will go through social services. So I know a lot of the people on this call, you guys may be self-direction brokers, case managers, mothers, right, or fathers of individuals that may be in OPWDD, right? So if they're in the Medicaid waiver, then most likely they're straight Medicaid, and they would go through social services for CDPAP. That would be the entity that administers the program. Now, those entities do the assessment, and for the individual to be eligible for CDPAP, first they have to be on Medicaid. CDPAP is a Medicaid-funded program. They have to be eligible for home care level of services, personal care or nursing level of services, and they have to require total or some assistance with those services. They also have to have a stable medical condition. And as I mentioned before, because the agency or the fiscal intermediary or even social services and the managed care plan, they're not the entity that is there to manage the care, right? That managing and directing of the care is done by the consumer or the designated representative. So the individual has to, part of the eligibility requirements, they have to be willing to fulfill those responsibilities. And sometimes CDPAP is not the right fit, but we see a lot of families, they like the control and the ability to choose who comes into their home to care for them.
Right, and so to further explain self-directing, because that may be a new term for a lot of us, self-directing means that someone is alert and competent and oriented and has the ability to make the decisions that are needed in the CDPAP program. So some of those responsibilities include signing off on a timesheet from the personal assistant. So as I go through these different items that the consumer would have to do, you can now think to yourself, maybe you know someone who might be good, who may be a good fit for the CDPAP program. Let's think about whether they would be able to take on these responsibilities. They would have to sign off on timesheets. They would have to train every caregiver that they enroll into CDPAP. They would have to supervise, so continuous supervision of the personal assistant. they would also have to essentially discipline. And if God forbid it didn't work out, they would also have to terminate their personal assistant. So there's definitely a lot of responsibilities that come with the CDPAP program. And if that consumer is not self-directing, you can definitely have a designated representative, which is that kind of point person to take on those responsibilities. Also, the consumer or the DR, the designated representative, would have to sign all of the agreements with the health plan as well as the FI. So you definitely want to make sure that you're considering whether a loved one that you know, or maybe it's even yourself, is willing to take on all of those responsibilities before enrolling into this program.
Very, very well put. Thank you, Megan. And just as a reminder too, that designated representative doesn't have to be a family member. So I remember a case where there was an individual. She was 23 years old. So since she was 21 or older, her parent was actually the personal assistant, and she was the only parent in the household. So that designated representative was actually the neighbor. So the neighbor was the one that was managing the program, and the parent was getting paid through Medicaid to care for her daughter. Now, once a consumer is determined as eligible for CDPAP, then there's a specific assessment process, starting with getting a physician order form filled out. So most commonly, it's called the DOH 4359 form. Also, I've seen a lot of people fill out the HCSP M11Q form. Basically, that is the initial step. So if somebody has never been enrolled in CDPAP, they first have to get that form filled out by their physician. Once that form is filled out, which contains the primary diagnosis, basic physical information, can the consumer safely receive these services in their home? The doctor is not coming up with the hours, right? That's determined by the social services or Medicaid managed care plan, which is the next part of the assessment, which is the social and the nurse assessment. So once that physician order is sent to the social services, if the individual is straight Medicaid, or Medicaid managed care plan, if they're in a health plan like Fidelis or Health First or Aetna, then that entity reviews the form and then sends out a nurse to do that social and the nurse assessment, where they're going to look at the different preferences of the consumer, check to make sure that the consumer can fulfill their responsibilities, evaluating some of their informal supports that they currently have, and then ultimately doing that nurse assessment, where they look at the plan of care and they determine what that consumer needs help with. And I commonly refer to CDPAP as a task-based program, because individuals get weekly hours based on the tasks that they need help with. So that's what the nurse will determine. Once they determine that, hopefully they'll approve the individual for CDPAP, and then they'll give him or her the plan of care, which outlines what the consumer or designated representative can use to direct the personal assistance. And then basically use that to also schedule the personal assistance throughout the week.
Now, you may be looking at this and thinking that's a lot of steps, so that's a lot of forms, but I assure you it's not. And actually here at Premier, we really help to handhold you through the process. It's really just maybe 3 or 4 bullet points of steps. You have to get that physician's order form, which really acts as if it were a prescription for home care. So it's really important that when you're making that doctor's visit with that consumer, or if the consumer is yourself, you're expressing all of your needs to the physician so that they understand that it is home care needs that you have, and that it's for long-term care. And then beyond that, after you get that physician's order form, you sign a couple of forms with the health plan, and then the nurse from the health plan comes out to do the assessment. And after that authorization is sent to our agency, and services can begin as long as our paperwork is completed as well. So it's not as many steps as it may seem, and really helps to facilitate getting the doctor's order form as well as the authorization from the case managers. And also just one quick reminder, please submit your questions to the chat box, not the Q&A. For those of you who came in a little bit late, the Q&A section is not working, so please submit in the chat. Thanks.
Thanks, guys. So this is a great slide and probably will answer a lot of questions that some of you may have. And I would even recommend keeping this for your reference as well when it comes to who is and who is not allowed to be a personal assistant. And once a consumer is eligible and they get assessed and approved, right, then they choose a CDPAP fiscal intermediary. And those personal assistants that they hire, train, and schedule signed up with that fiscal intermediary. Now, those personal assistants, by regulation, they don't have to have any certifications. The whole screening and interview process, that's totally up to the consumer. Now, some might say, you know, well, that's not safe if the personal assistant is not trained or certified and stuff like that. But you also have to remember the whole fundamentals behind this program and why it was created is because it's family members and friends and people in a community that may already be caring for this individual and assisting them. And they're probably doing it better than a lot of nurses can even do it, right? Because they've been doing it for so many years, or they just know the individual because they're always with them. So that's why this program was created. Now, on the left side of the box, you have the individuals that are allowed to be the personal assistant. They have to be 18 or older. It can be a relative, friend, or an individual from the community, even if they live in the same home. And this is an important item. So if there is a consumer and the consumer is 21 or older, then the parent can be the personal assistant and get paid through Medicaid. Now, over to the right side of the box here, it's individuals that are not allowed to be the personal assistant. So if you're younger than 18, the designated representative cannot be the personal assistant. So that's the individual that manages the program if the consumer is not able to do so. So a way to kind of think about that is you can't be the boss and the CEO and then also be the employee. You kind of have to choose one. And it's the legal spouse is also another person who's not allowed to be the personal assistant in CDPAP. And for those consumers that are under the age of 21, the parents are not yet allowed to be the personal assistants. However, we usually recommend for another family member, you know, whether it's an older brother, sister, uncle, cousin, something like that, to step in to be that personal assistant.
So I would just like to circle back to that point on the bottom left-hand side where it says the parent of the consumer, when the consumer is 21 years old or older, can be the personal assistant. So I know that we have a lot of families with special needs children on the call today, as well as maybe healthcare professionals who assist families with special needs individuals. That is such an important item because when you think about it, there's so many families where the parents feel like, you know, unfortunately, it feels like a thankless job for many years in which they're caring for their child with special needs. And once that child is 21, the parent can enroll to get paid for doing what they've been doing already for years, which is really a beautiful thing. Now, when I explain this to parents, sometimes I get parents feeling guilty, saying, I don't want to get paid for caring for my child. This is something I do out of a labor of love. We get that 100%. But there's nothing stopping you from taking the money that the parent earns and putting it into a fund for the child, or using it to take the child out on outings, because the whole premise of CDPAP is to be out in the community, not home-based. So we like to really educate families and really healthcare professionals as well, just to remember that this is an option for so many people. And even if it can't be the parent, because maybe the parent doesn't want to take on that responsibility of being the personal assistant, like Joe mentioned, it can be an older sibling. It could be any sibling that's over the age of 18 years old. It really opens up, you know, just a wide array of people that could really do this. It could be family members, neighbors. If it's a special needs individual who has a respite worker, it can be that respite worker that they love so dearly. It can be their ABA therapist or their speech therapist. You know, the options are really endless. So we just really encourage you to really think outside of the box of really who can help this consumer that you're thinking of. because it really is a labor of love, and it really takes a village to sometimes raise a child, especially when it comes to special needs children.
Yeah, it's definitely one of my favorite parts about CDPAP. And I just saw a question come in. Actually, it was if the mother is the designated representative currently, can she pass that position onto her husband, and then can she be the personal assistant? And the answer is yes. Now that has to be approved by the social services office if the individual is straight Medicaid, or the Medicaid managed care plan. But it is definitely possible. So just reach out to your health plan. Because then,
one more thing I thought,
yeah.
oh, sorry. One more thing, I just saw a question come in. I can talk faster than I can type. To answer verbally. Somebody asked, let's see, what does the DR do? So the designated representative acts on behalf of the consumer if the consumer is not self-directing to direct their services. So they are coordinating the schedule. They are definitely coordinating the schedule if the PA calls out. They're signing timesheets. They are training, hiring, recruiting, supervising. There's a lot of responsibilities, and we can definitely send you a list of what those responsibilities are. It's also very much very easily listed on the Department of Health website what those responsibilities are, but the DR is in place if the consumer is not self-directing.
Exactly. And so now let's take a dive into fiscal intermediaries, right? Sometimes referred to as FIs. Now, don't get this confused. I know some of you may use that popular program called self-direction. Now that FI is totally different from this one. So this is a fiscal intermediary for CDPAP. And Megan and I are part of Premier Home Health Care, and we're actually a statewide CDPAP fiscal intermediary. We have very competitive pay rates, and something that makes us unique is that we're actually the only fiscal intermediary that's associated with the 1199 Healthcare Workers Union, which is a huge plus, and a lot of our personal assistants love that. So they'll receive the benefits of vacation pay, health benefits, and education fund. So you know, when it comes to choosing an agency, you know, really making your personal assistants happy, you know, that's something, you know, when it comes to retention of you know, personal assistance, you know, that's something that can definitely help. And our goal, you know, coming from a background, really knowing, you know, what some of you may be going through, we try to make the process as simple as possible, and we try to handle as much of it as possible, because we know that you guys have your plates full with a lot of other items going on throughout the day, you know, because we know it's not easy.
So I just want to circle back again. There really, when I think about why families choose Premier over a lot of other different FIs, because there are so many options out there. Right now, there's about 600 different FIs throughout New York State, but they don't all handle New York State, and they all definitely are not affiliated with the 1199 Healthcare Workers Union. So those are two pluses when it comes to Premier, that we are statewide, so it's never a question of if Premier can help you or a loved one that you know. The answer is always yes. We accept all health plans, all insurances, and we are affiliated with the 1199 Healthcare Workers Union with those awesome benefits that our personal assistants love. And lastly, we have a really quick and easy online enrollment process. That way, there's no need to come into an office to drop off paperwork. There's no home visits that are necessary, because a lot of times people choose CDPAP because they don't really want people coming into their home, and we get that. That's your sanctuary. So we have that online enrollment so that people feel safe and comfortable in their home, and especially in times of a pandemic, that's a real huge plus.
Yeah, we have a very streamlined onboarding process as well. So why do people choose CDPAP over other traditional types of home care? So if an individual is given, let's say, 40 hours a week CDPAP, they can actually hire as many personal assistants as they want, as long as they don't go over those 40 hours. So they can hire 4 personal assistants that work 10 hours each, or they can have 1 personal assistant that works the 40 hours. And along with that, in CDPAP, the individual is given a weekly bucket of hours that they can use flexibly, you know, depending on their specific needs. So they can have 2 hours on Monday, 1 hour on Tuesday, and then use, you know, 10 hours for the rest of the week. And then the next week they can do something different. So, you know, that's a huge plus as well. You know, going back to, you know, how, you know, the consumer is the one that's in charge of the scheduling. One of the more popular items of why people choose CDPAP, family members and friends, they can be the personal assistants. And don't forget about the other people, you know, throughout the community as well. They can also step in and help. So if you make a post on a Facebook group, I know that there's some big Facebook groups where you can make a post and say, you know, I'm looking for a personal assistant. You can post an ad online. You can go to the nearest college campus, you know, look for maybe a nursing student, or, you know, so there's a lot of different options that you may have, even for those consumers that they may be in a specific culture, or they may speak a different language where, you know, finding a caretaker is hard enough, but then their potential, you know, people that they can use, you know, kind of dwindles down, right? So having family and friends that are already in that culture and can already, you know, speak that language, you know, that's a huge help. And another huge part, you know, and some individuals really need to use CDPAP because of this reason, is because, you know, of those nursing tasks. In CDPAP, the personal assistants are allowed to do the nursing tasks, and that's not, you know, that's not allowed in a lot of the other different forms of home care. And as I mentioned before, the consumer, not the agency, is in charge of the screening, hiring, and firing of the personal assistants. And that whole managing of the program is done by the consumer or the designated representative. And there's a pretty low barrier to entry when it comes to becoming a consumer or a personal assistant. As we mentioned before, the eligibility requirements are really pretty flexible, right? And even the assessment process can happen relatively quickly.
So I just want to chime in. This is actually my favorite slide. I can't even pinpoint which bullet point is my favorite. I just love this whole slide. So to give you some history, I actually worked in Premier's licensed home care division for about 6 years before transferring over to CDPAP. So as I was a professional working in that side, I saw a lot of these barriers or hindrances that families experienced. For instance, the fact that on the licensed home care side, when you're receiving PCA or home health aid services, the authorizations are mandated. It tells you exactly how many hours the client can receive each day. It'll say something like Monday, Wednesday, Friday, 8 hours, versus CDPAP. They give you a weekly bucket of hours, and that consumer can use those hours however they want, and it does not need to be the same every week to week to week. It can switch, so they can have overnight hours one week and then have all the hours on the weekend the next week. It's really flexible, and that's why a lot of consumers love it. Another reason that this slide is my favorite is, like Joe said, family members and friends and beyond can be the personal assistants, neighbors. You know, it's just the choices are really limitless, as well as solving the cultural and language barriers. So in my experience over at the licensed home care side, and even for our case managers or other healthcare professionals that are on the call, I'm sure that you definitely have heard complaints from clients, from your clients, saying the caregiver that they sent me doesn't know my language, or the caregiver that they sent me doesn't know how to make the food that I love, and it's like a cultural specific food, or maybe the caregiver is not familiar with a kosher kitchen, or maybe the caregiver is not comfortable taking off their shoes before entering the house, and that's really like something that the family really wants them to abide by. There's so many things that, you know, makes it a family specific and a culture specific. And in CDPAP, they can hire someone from within their culture that just gets it, and they don't really have to explain themselves. And the whole point of CDPAP is so that people can be comfortable in their homes, whereas sometimes on the licensed home care side, people weren't always comfortable in their homes because they felt like they were tiptoeing around the caregiver. Now, the next bullet point, those skilled nursing tasks, So I just really want to let that sink in for a lot of you. Skilled nursing tasks include medication administration. Did you know that on the licensed home care side, the PCAs and the home health aides, they're not allowed to administer medication? So that's why a lot of people choose CDPAP, because those personal assistants can do that. They can provide oxygen care. They can assist with the feeding tube. These are all things that home health aides can't do, and that frankly, they would get in trouble if DOH or the health plan found out that those caregivers were doing it and they're not supposed to, because technically they're not trained. Now, to Joe's previous point, the personal assistants are also not trained by a health plan or by an agency, but they're trained by the consumer or the designated representative, which in my experience on the licensed home care side, when we used to send out nurses to the client's home to supervise the caregiver, maybe with a Hoyer lift or with dressing, toileting, things like that, oftentimes, more often than not, it was the family member teaching the nurse how things are done, because nobody gets it like family. If they're around it all the time, they're going to do it the best way possible. So this is why this is my favorite slide.
Yeah, and definitely try to keep some of these in mind, because we are going to be discussing how this kind of ties into some of the changes that are going to be happening, and the importance of knowing the difference between CDPAP and some of those traditional types of home care. That's very important right now, especially for all of you people that are current consumers. So we're going to tie that in. And there's certain myths about CDPAP, and we're going to bust them. So you don't have to have, in order to be a CDPAP consumer, you don't need severe medical needs in order to be eligible, right? As long as you meet those eligibility requirements, which is just needing help with at least one of the home health, personal care, nursing level of services, then you can possibly be eligible for this program. And there was this one individual that he could actually lift 400 pounds at the gym, and the mother came to me and she asked if he could possibly be eligible for this kind of program. The individual was already in his 30s, right? And she never really thought that he would be eligible. But I encouraged her to try to get assessed by social services, and he ended up getting hours, right? And now his father is helping him with hygiene and helping out with meal prep, shaving, stuff like that. So it's been a great thing, right? So I always tell families, go for it. Try to get assessed. What's the worst that can happen, right? This program is not for supervising or monitoring of the consumer. It's not for babysitting, stuff like that, right? As I mentioned before, it's a task-based program. So the individual is going to get a certain amount of hours based on those what's called the instrumental activities of daily living, the activities of daily living, or the nursing tasks. And starting with the instrumental activities of daily living, those are items that help the individual live independently in the community, like running essential errands, cleaning, laundry, stuff like that. Activities of daily living, and then you have the nursing tasks. So, when that assessment happens, when that nurse from either the health plan or social services comes into the home, saying words like, I supervise him, I monitor him, I babysit him, that's not how you're going to get hours. And that might even be a reason that the nurse may say that they're not going to give you hours. So try to stick to those specific items that are in that plan of care. And another myth, I've had some people tell me, if somebody's under 21, they can't have CDPAP, or, there's certain, age limits or, stuff like that. But the reality is that we have infants in our program. We have World War II veterans in our program. So there's a wide range of, ages when it comes to people that could be eligible for this program. And a consumer's health proxy and the power of attorney are also allowed to be the personal assistants. I actually got Department of Health confirmation in regards to these. So basically, if somebody is, a health proxy or power of attorney, that designation doesn't disqualify them from being a personal assistant. So it's definitely something to keep in mind. And if you ever run into an issue with that, I can even forward you some of the proof, right? So if social services or maybe the health plan is not aware of that. So it's definitely something to keep in mind.
So I'm just going to jump in because I'm still seeing questions coming to the Q&A box, and unfortunately it's not working for me to respond. So if everyone can just submit their questions to the chat box, I'd be happy to answer. I did see a question come in that said, someone said that they're confused and they don't know how to begin. You may have missed the beginning portion about the different steps that it takes to start enrolling, but the synopsis of it is everyone on this call, if they are thinking of someone to enroll into CDPAP, may be at a different step of the enrollment process. Some may be already Medicaid eligible. Some may need to apply for Medicaid. Some may already have that physician's order form. So what I recommend is just to email myself or Joe, and we'll figure out at what stage of the process you are in, and we'll make it work for you. We're really going to handhold you through the process. It sounds daunting and overwhelming, but I promise you it's not. So that's why I just encourage you to either call our main number or email myself or Joe. We're pretty approachable. You can definitely ask us any question. But I also did want to talk about one of these bullet points. The bullet point number 2, where it says this program is not for supervising or monitoring of the consumer. It's a task-based program. I just want to really clarify what that means. So for instance, I've worked for a number of years, over 10 years, with children with autism directly, like direct care, and I became very close to a family that enrolled in CDPAP before I even got involved in CDPAP at this position that I'm in now. So I was more than willing to help the family with their CDPAP needs, knowing that they were at a different FI. But something that was striking to me was the fact that this consumer, who's an adult child with special needs, he has autism, he has a seizure disorder, he's nonverbal, he's an elopement risk, he has no spatial awareness, and he can't do things like toileting or feeding himself. He was only approved for 20 hours a week of CDPAP, which blew my mind. I mean, I know this individual for over 10 years now, and I'm thinking, how did a nurse sit in front of him, assess him, and only give him 20 hours a week, knowing that he has all these, special needs? So I asked the mother of the consumer, how did you answer the nurse's questions? And she said, oh, well, I told the nurse that he needs supervision when toileting and he needs to be reminded to eat. And I looked at her and I said, wait a minute, he doesn't need supervision when toileting. He has a diaper. You physically toilet him. And he doesn't need to be reminded to eat. You literally have to cut up his food, else it's a choking risk. So these are things that the mother wasn't thinking of because she's just, obviously she's got so much on her plate, she's rushing through the assessment and she just wants to get it over with and on to the next thing. But as I broke it down for her, she realized she didn't use the right verbiage and she really failed to tell her son's story appropriately, which was pretty saddening. So I was able to share a sample care plan with the family, and they were able to look at the different tasks that the nurse would be asking the family what he needs help with. And we wrote it all out. We wrote out what his worst day would look like. So imagine if he's having behaviors, he's having a tantrum. What would that worst day look like? Would he be able to get his clothes on? Would he be able to make it to the bus for day program? Like things like that. So after going over the care plan, they scheduled a new nursing assessment, and the nurse came out, and I'm happy to say that instead of for 20 hours they were approved for per week, they are now approved for 80 hours a week, which is a huge success story. So that's why I think it's really important to really loop in people who really understand CDPAP like me and Joe before you get those nursing assessments set up, because you really have one shot to really tell your story. So it's really important that you do it the right way and you do yourself. You don't want to do a disservice to your loved one who needs these services. So loop us in right away. We're happy to help.
Exactly. And so some of you have experienced this firsthand, but there's definitely a shortage when it comes to finding good, dependable staff, right? Personal assistants. Now, especially in places like on the east end of Long Island, some places in upstate New York, where there's just historically been a shortage, right? And having now family members and friends being able to kind of step in that helps to solve it. So that's one area where CDPAP helps. Now, also for those individuals that require the nursing level of care, and that are straight Medicaid, knowing that the reimbursement right now is extremely low, for those nurses, a lot of families have been using CDPAP as that second option, because the personal assistants are allowed to do those nursing tasks. So if you know somebody that they really require that nursing care, but they're really struggling to find a nurse, maybe they can use this and they can go recruit at a school, as I mentioned before, right? They can find a nursing student. Those are I've seen a lot of families be very happy doing something like that. So there are definitely options there. Now, something that Premier does, which not a lot of fiscal intermediaries do, is we have a database, basically a list of caretakers that have expressed to us that they are that they want to work, and we can provide that list to the consumers or designated representatives, and they can use that list and recruit and hire people off that list. Now, as a fiscal intermediary, by regulation, we're not allowed to staff cases. We're not allowed to send personal assistants to a case, or even recommend a personal assistant. But we can send a list, by territory to a consumer, and then they can call them up. If they pass their phone screening, they can have them in for an interview, and then they can hire them. And going back to the fact that we're the only fiscal intermediary that's associated with 1199 union, that's something where we have a large pool of these personal assistants that are willing to work. And I do know that a lot of families struggle with this side. Just being a part of a lot of Facebook groups, and even listening to my father who works with medically fragile children, seeing the struggles there. So we're trying to be a solution, and we're trying to do our best here. We're not saying that we're the magical answer, but we'll do our best to help out. So just keep that in mind.
Yeah, so we have that personal assistant list that we can, or caregiver list that we can provide to families as a resource if they're struggling to find someone to be the personal assistant. Because for many families, they may already have somebody in mind that they want to be the personal assistant. And for other families, maybe they really like the autonomy and independence that comes with CDPAP, but they just have no idea who could be that personal assistant. Like Joe mentioned, we are affiliated with the 1199 Healthcare Workers Union. They have plenty of caregivers who are eager to work and they know what they're doing, as well as we have developed resources. We call them consumer guides that we share with families. And it's literally like a to-do list of how to recruit for a caregiver, screen, interview, even how to handle grievances with your caregiver, because that may be new for a lot of people. So we provide these resources, and we also have CDPAP specialists 24/7, day or night, on holidays, available to answer your questions whenever they may arise. And CDPAP really has helped to alleviate the caregiver crisis and the caregiver shortage. Because when you think about the licensed home care side with the PCAs and the home health aides, they are required to not only get trained, they have to get certified, they also need to attend an orientation, and then they have to attend usually once, maybe annually or twice a year in services to upkeep their education. So how does that impact the client? Well, that caregiver is now pulled away from the client to attend these orientations, these in-services, these continuous trainings, as well as the agency's nurses coming into the home to evaluate the skills of that caregiver. So that's the licensed home care side. The CDPAP side is a lot more hands-off from the FI side. That's us, the fiscal intermediary. We don't come into your home. We don't send a nurse. We don't even have a nurse on staff, because that consumer is training their caregiver, and their caregiver is required to be trained by the consumer. It's a pair, it's a duo. They're working together, and the consumer can hire whoever they please. they can have requirements for the caregivers that they're recruiting. They can ask to see a resume. They can say, I want somebody who has healthcare experience, or I want someone who has babysitting experience. That's really all up to the consumer. So that's a really exciting factor of CDPAP that not a whole lot of people know about.
Yeah, and going off of what Megan mentioned, especially during these times in COVID, maybe yourself or maybe somebody that you know, maybe they got furloughed or they don't have a job, right? But they have somebody that's on Medicaid or that could possibly get on Medicaid and needs that assistance. We've had a lot of families come to us recently in this circumstance, that because everybody is home now, kind of 24/7. It's something where now they can get paid to be home, right, and continue to help out their loved one.
And I just want to answer a question that I saw come into the Q&A. Again, please ask your questions in the chat. I can't respond to the Q&A. So a question that came in, somebody asked if we're currently taking on cases or if any FI is currently taking on clients with the pandemic. I can't speak on behalf of other FIs, but I did mention that Premier has that really easy and quick online enrollment process. And we do webcam like visits or calls. So there's no home visit that's needed. So yes, we are currently taking clients and all throughout the state of New York. And yes, that was mentioned earlier.
Yeah. So, the future of CDPAP. Now I'm going to get into, some of the details with this. So this will be helpful, for those that are new to the program. I don't want to discourage you too much here, right? But I know that some people have kind of joined this call to see some of these updates, because within these past couple of decades, I know that the changes that are about to happen are enormous, and are definitely huge changes and things that you definitely want to be aware with, and make sure that any of your friends that utilize CDPAP are aware of as well. So the first and probably one of the biggest items here, a couple months back, the Department of Health, they basically put out a request for offers, which is basically like a contracting process for the fiscal intermediaries. Now, Premier Home Healthcare is one of the over 600 fiscal intermediaries in New York State. And Department of Health has come out and said that there's been a lack of oversight with the program, saying that there's been fraud and stuff like that. And to get Medicaid savings, and to have more control of this program, Department of Health is looking to use this contracting process called the RFO as also a way to do a consolidation. So going from those 600 fiscal intermediaries down to what we've heard, maybe somewhere between 5 to 25. And this is a decision that has been looming around for the past maybe year. But the decision is actually going to come out, at least it was updated on the Department of Health's website. It'll come out this Friday, so the 17th. So it's going to be huge news, and possibly there could be a lot of FIs that go out of business. So we're going to go further into what to do if this happens. If you happen to be with an FI that didn't make the cut, right? That is not considered a fiscal intermediary anymore. We will go over the details in kind of how to proceed. And for those that are new to the program, you want to definitely make sure that the FI that you join is one that they've basically applied for this RFO, because if they didn't, then you'll have to just switch out, in a couple of months. So you want to make sure that the FI that you choose is going to be one of the ones that remains. And as I mentioned, hopefully that announcement is going to come out Friday. Now, along with that, there's a separate change that it's a reimbursement change that's specific to the fiscal intermediaries. It's called a basically going from a fee-for-service model where the agency gets paid per hour that the personal assistant works. Now it's going to go into a per member per month model where the fiscal intermediary gets a certain reimbursement based on the amount of consumers that they have, and also depending on how many hours out of the month that that consumer has. And the way that the Department of Health is going about this, it's going to be an enormous cut. So, you know, that's something to understand as well. And this is not going to, at least at Premier, we are going to try our best to, you know, not make this affect the personal assistance pay. So these are two main changes, right? So, and it's important to know that CDPAP is not ending. I'm going to be going through some other changes, but you know, these are some of the ones that you know, have been looming for the past year. So, you know, definitely some important items here.
So for those of you who are already receiving CDPAP services and are in an FI, the FI may be pressuring you to consider licensed home care services, PCA and home health aid services. And this is now because the Department of Health is trying to reduce the number of FIs, and your agency may be seeing the writing on the wall and maybe understanding that they may not be one of the remaining FIs after DOH makes that decision. So if that's the case, if your current FI is pressuring you to consider PCA or home health aid services instead of CDPAP services, they're actually not allowed to do that as per DOH, because it's really the consumer or the DR's right to choose whatever home care option is best for them. They really should not be pressuring you. And that FI is probably doing that because they still want an income. They still want some revenue in their pocket. And they know that if they have two streams of businesses, the FI side and the licensed home care side, they're hoping that you'll still stay with them and go into the licensed home care side. Now, that's not right, and they're doing the wrong thing. So if you do want to continue with CDPAP services, Premier is confident that we will be chosen as one of the few remaining FIs in New York State. So you're always willing to come over to us.
And I did see a question, you know, when will this be going into effect? Now, we do know one thing, that it will be announced on Friday. At least that's what the Department of Health said. They've already delayed it once, so, you know, but if it does, you know, get announced Friday on which fiscal intermediaries are approved, they have not yet come out with a timeline in how that will actually happen. So, you know, how long will they give the consumers to transfer if their current fiscal intermediary ceases operations? So there is no timeline on that, but you know, maybe that might come out when they announce it. So we will definitely keep you guys updated on that. Now, just as Megan mentioned, for those consumers that find themselves in a position where their fiscal intermediary ceases operations, right, because they didn't make the cut, they're not considered a fiscal intermediary anymore, there are specific transfer rights that they have when they're transferring to another fiscal intermediary. So this is a very important thing. As I mentioned before, if you have any friends or anybody that uses CDPAP, they should be aware of this, because as these fiscal intermediaries are forced to cease operations, they may be licensed home care agencies, and they may have a traditional home care branch in their company where they have home health aides or PCA services. Now, and they may try to convince or push their consumers into that branch to maintain the revenue, right? They want to make sure that they still have a business. Now, going back to why individuals want to keep CDPAP versus going into those traditional types of home care, I'd say the number one reason, those programs are not consumer directed. The consumer doesn't have a say with who comes into their home. They're not the ones that schedule, hire, train, stuff like that. You can't have a parent be the caretaker. Um, you know, you can't do nursing tasks. So there's a lot of, you know, reasons why, you know, you don't want to, you know, get pushed into those traditional types of care. So if there's anything in here that I would like for you to spread the word, um, definitely make sure that anybody that you know that uses CDPAP and that finds themselves in a fiscal intermediary where they're ceasing operations, that they know these rights. It's very important. So the first item is, before the fiscal intermediary ceases operations, they must give the consumer, the designated representative, and the personal assistants 45-day notice that they are ceasing operations. And within 5 days of that, the managed care plan or social services office has to give them a list of fiscal intermediaries that they can choose from. So that list will be the ones that basically got approved by Department of Health to continue providing CDPAP services. And that fiscal intermediary cannot take any action to prevent a consumer or the personal assistants from switching to another fiscal intermediary, and they cannot force or require the consumer to go into personal care or a home health care type of program. That's important. And to make things easier, this is something that I do like. The Department of Health has basically said that the old fiscal intermediary has to, through the request and consent, pass over the consumers and the personal assistance files to the new FI. So that will make the transition easier, and it's definitely something to know that you have that right, because I'm sure that the current fiscal intermediary is not going to tell you that. And the social services office or the Medicare Managed Care Plan, they're the ones that are supposed to supervise this transfer. So if you have any questions, if you happen to be coming to Premier, you can ask us. If you're not, you can ask your other FI, or you can ask, you know, the social services or the Medicare Managed Care Plan, and they should be guiding you in the right direction. So this is a resource that I've noticed a lot of people are not aware of. It's called ICANN, the Independent Consumer Advocacy Network. So if you have questions about a managed care plan, how to enroll, or you need long-term care, you know, this is a free resource. You know, these are advocates that you can call, whether you're having an issue with the plan or something like that. You know, you can reach out to them, and I've even done it myself, and I've referred many families to them. So definitely use it as a resource. Now, one thing that was actually announced yesterday was that so for the longest time, and even a lot of you may already be doing this, but technically it's not allowed. Yesterday, Department of Health approved personal assistants to be able to transport or accompany consumers to medical appointments. So it's, you know, like I said, it's something that a lot of you may have already been doing, but now it is technically allowed in CDPAP, and it's a way that New York State is trying to get savings. You know, so how much savings that they'll get, we'll see, but you know, also keep in mind that there won't be any additional hours authorized for this transportation. And the personal assistants are not basically eligible to receive any reimbursement, you know, when it comes to any costs, you know, incurred when getting, when transporting the consumer. So this is an update that we got yesterday. So I decided to, um, I thought it would be a nice thing to fill you guys in with. Now, I went over a lot of those looming changes, right? That were, I'd say, like the past year, when it comes to that reimbursement change, that RFO, the contracting process, but on June 30th, there was actually um, some more changes that were released due to the Medicaid redesign team. It was called the MRT2, and these proposed regulations were actually placed on the New York State Register today, and it basically outlines some major changes to the CDPAP program when it comes to the eligibility and the assessment process, and some of the more details which I'm going to go over with you guys. An important thing to know is that with these changes happening, the current consumers that are in CDPAP are going to be grandfathered into it, and they're not going to have to meet these new requirements. And it's something that they're trying to push to implement as of October 1st. So, if somebody is on the fence of using CDPAP or not, I would definitely recommend to try to get into the program as soon as possible, because the eligibility requirements and the assessments process is not, it is definitely not good. So, it's something where you definitely want to take advantage of how the program is set up now. So a common theme throughout this proposal was that, now the local social services office or the Medicaid managed care plan basically has to evaluate the consumer, and really take into account the different informal supports and services and alternatives that the individual can access, and evaluate it and see what is the most cost-effective option. And this is alarming because, like I said, it was very excessively written throughout the proposal. So one of the things that Department of Health is really trying to do with this program that is growing very quickly, they're really trying to make it as difficult as possible for individuals to now get these services. So that's going to go with some of the eligibility requirements, and through the assessment process. Now, this is a huge change, this second bullet point. So as you guys remember, when I went over the eligibility requirements earlier, I said that an individual can be eligible for CDPAP if they require assistance with at least one of the personal care, home health, or nursing level of services, right? So that's a huge range of instrumental activities of daily living, all the way up to skilled nursing tasks. Now, Department of Health is limiting that by a lot. So now they're going to limit it based on those that need assistance with the ADLs, which are the activities of daily living. So there's two basic branches to that. It's individuals that are diagnosed with dementia or Alzheimer's. They must need at least supervision with more than one ADL. So that is a huge change, right? Because if if somebody needed help with a couple of the instrumental activities of daily living, like laundry and cleaning and stuff like that, they can still access CDPAP the way it is now. But this change, they wouldn't even be eligible for the program. And the other group of people are all the other individuals. They would to need at least limited assistance with the physical maneuvering with more than 2 ADLs. So that, like I said, that really disqualifies a lot of individuals from getting access to this program. So like I said, if somebody is interested in CDPAP, definitely have them try to enroll now before October 1st. Almost like some of the changes that are happening with Medicaid right now in these next months, you want to try to take action now. I know I was speaking to somebody today and they mentioned how their son was going to be 21 in March and they were going to get CDPAP to work for their son. But I would recommend getting into CDPAP now, getting assessed and approved for services now before October. You can have another family member or a friend be the personal assistant. And then as of March, then you can, sign up. So this is a huge change. Now this third bullet point, it basically says that, supervision and queuing can be provided, but there's not going to be any hours given for that. So it's kind of like they kind of went halfway on this. As I mentioned earlier, this program is not for supervisory monitoring, but they basically said now that it can happen, but they're not going to give hours for it. So that's something, a change that they made.
Yeah, and Joe, that was a good point that you made before. I can't even tell you the amount of times that Joe and I are out in the field and we're meeting families and they're telling us their stories, and then we mention the fact that a parent can be the caregiver to the consumer, to the adult child once the child is 21, and the parent then says something to us like, oh, my child's only 19 or my child's only 18, and then they get discouraged and they don't want CDPAP. We don't advise for that. We advise that the consumer, that adult child, should get enrolled ASAP and just have somebody else be the personal assistant until the family member, like that parent, can be the personal assistant when that child is 21. So there's no hindrance for the consumer to not get enrolled as soon as possible. There's no minimum age, there's no maximum age for a consumer to enroll in CDPAP. We have pediatric cases, we have the geriatric population. So there's really nothing stopping you. And like Joe said, it's really better to get grandfathered in at this point because there are so many changes coming down the pike effective October. And to just circle back to bullet point number 1, what that means is that those assessing the consumer to see if they are appropriate for CDPAP and home care, they're first going to try to exclude all other support systems like equipment, like maybe instead of providing the consumer home care, can we alleviate some of the consumer's needs, for assistance with equipment in the home, like a wheelchair or a walker, things like, or Hoyer lifts, things like that. Or maybe there are voluntary informal support systems in place, like in a responsible adult that's willing to just step in when necessary rather than actually being the caregiver in CDPAP. So they're trying to really exclude all those other supports before allowing CDPAP services to begin, because CDPAP is a little bit more costly for the state, so they'd rather use those things instead. This is new. These proposals just came out recently, so that's why we really encourage you to consider enrolling as soon as possible before all of this really takes place.
Yeah, so definitely, you can even, I would even recommend, waiting until Friday. Maybe the notice comes out and which FIs get approved. Once you know that, then you know that you should call one of those FIs, and then get enrolled as soon as possible. Because right now, you really want to avoid signing up with a fiscal intermediary and then them not making the cut and then having to go and sign up, because I would say that that's really the biggest part of the onboarding process is getting that medical paperwork and the enrollment documents to that fiscal intermediary for all those personal assistance and the consumer's paperwork. So you don't want to do that twice. So I would even recommend, waiting until Friday, seeing if the news comes out, and then, making the decision there based on which fiscal intermediary gets approved. Now, to continue with some of these changes, the definition of self-directing consumer changed slightly. Basically, to really, it changed to really how I always kind of said that a self-directing consumer is, which is it's somebody that is able to fulfill the responsibilities. So they're able to hire, supervise, train, and fire the personal assistants if it comes to that. So that's really what the definition now is in the regulations. And another huge change. So along with the eligibility changes, now we have the assessments, right? So earlier, that was one of the positives about CDPAP, was that it was super easy. Basically you just have to get that physician order form, which is the medical form filled out by the consumer's physician. That form gets sent to the health plan or social services, and then they send out the nurse to assess and then approve the hours. Now their Department of Health is putting a lot more steps to the assessment process, which is in turn making it harder for those to get these services, which is Department of Health knows that they can't take away these services, so they're just trying to make it as hard as possible for families to access them. So the first assessment, I'll even start with the conflict-free assessment. That's when Maximus, also known as New York Medicaid Choice, comes in for those individuals that are in both Medicaid and Medicare, and they assess the individual for long-term services, long-term care services. Now, after that assessment, then there's an independent assessment done by, we think it's probably going to be Maximus or slash New York Medicaid Choice. Again, they're going to do that social / environmental assessment. So they're going to take a look and see, they're going to look at the informal supports and look at the different services and really see is this the right, are they going to benefit from a program like this. Now once that assessment's done, then there's another independent assessment, the independent medical assessment done by that third party entity. It's probably going to be Maximus or slash New York Medicaid Choice. Basically, they're going to come up with the plan of care, and they're going to do that review of the consumer, and then after that, then the social services office, or if the individual is in a health plan, it's the Medicaid Managed Care plan. Then they're going to do their assessment. And to make it even worse, after that, if the individual is eligible for 12 or more hours a day, then there has to be an independent clinical review panel, which basically is another step where a physician basically comes up and assesses and checks to see if this is the most cost-effective option, and make sure that the individual can safely receive these services. Checks to make sure that the independent assessments and the social services or the health plan that they did everything correctly. So there's going to be a lot of steps and a lot of individuals that can potentially put a stop to somebody trying to get these services. And that's really what the Department of Health is unfortunately trying to accomplish. And in these proposed changes, they also go over the different details when it comes to the assessment process, and for that physician order form, as we mentioned earlier, that form is is going to be completed by Maximus or New York Medicaid Choice. And even though these proposed changes didn't come out and say that, it basically says that it's going to be an independent contractor. It's probably going to be Maximus. So that's just something to keep in mind as well.
So somebody actually just asked a question that pertains to this slide. Can the psychiatrist fill out the medical form, that physician's order form, if the individual's needs are due to autism? That's a great question. To be honest with you, these are proposed changes, and what they are proposing is that any physician who has a previous patient-physician relationship with that individual is not allowed to sign off on the DOH form, that physician's order form. So it's still not really clear, that they're not really like spelling it out for us of who can really fill it out, other than the fact that it cannot be someone who has previous history with the client, because for obvious purposes they may be biased, and the state is really trying to reduce or just protect their funding right now with all these Medicaid cuts. So I don't really have an answer for your question right now. That really remains to be seen. But as soon as we know, we'll let you know.
Yeah, so it's just another reason to try to get that physician order done now with the consumer's primary physician, because once October 1st comes, it's not going to be the primary physician. It's going to be some third party that's going to be doing it. And as Megan mentioned, they're not going to have that relationship, with the consumer. So that's definitely
one other question, Joe. Another question that came to me privately asking: are existing active CDPAP consumers going to be affected by these changes in the assessment? We're reading online that active consumers are going to be grandfathered in. So maybe that these proposed changes wouldn't affect them. That's what we're seeing right now. That's all that we know right now. I guess we'll see what the state says in the coming weeks and months.
And then, as I mentioned earlier, the local Department of Services or the Medicaid Managed Care Plan, although there are those other independent assessments, social services and the Medicaid Managed Care Plan, they're going to still have their responsibilities, right? They're going to be reviewing the supports and seeing if it's the most cost-effective option. Seeing in what kind of seeing how often a nurse has to go in for supervision, coming up with the plan of care, and ultimately, as I mentioned before, if somebody requires 12 or more hours a day, then they have to refer them to the independent clinical review panel, which is, unfortunately, it's like another it's another entity that can delay it, and even potentially say that maybe there's a reason that they shouldn't, or that they should get those 12 or more hours a day. So now, when it comes to that, one of the things that some of the health plans and have been doing now is they have been allowing consumers to be a part of two fiscal intermediaries at the same time, which really what they're trying to do most of the time when they do that is to prevent personal assistants from getting paid the time and a half for the overtime, which is not a good thing, right? Because they're trying to get around that, which is not right. If a personal assistant's going to work more than 40 hours a week, then they should get paid time and a half for all those hours past 40. So these changes, I guess this is a positive. This is one of the positives that will happen, is the fiscal intermediaries. A consumer will just be authorized to be with one fiscal intermediary. They will not allow to be with two at the same time. And Another big change, which is another positive, and something that a lot of families and advocates wanted, um, especially looking at the fact that in order to be eligible for this program, you have to have a stable medical condition. Um, it's moving that authorization from 6 months to 12 months. So when the consumer gets approved for the services, instead of a nurse having to come in every 6 months and then getting authorized, getting the authorization every 6 months, now it'll be every year. And I do like that also in when it comes to the stance of where we are currently. COVID. I think the least amount of people that can be coming into the home, the better. Um, I also know that they are trying to explore some of the telehealth options as well. Um, and through these proposed changes, they're also providing the additional um, justifications for reducing or having to discontinue the services. Um, and one negative thing, and an important aspect of, some of the case managers, whether self-direction brokers, attorneys, um, you know, everybody that is on the call, being aware of this program in general and being able to share that with the community and with families that actually need it is important. And it's going to be important after October 1st, more than ever, because the plans are not going to be required to notify individuals of this program if they are utilizing other types of home care. And as I mentioned before, it's another effort by New York State to try to limit the growth with this program. And through these changes, it's one of the other items here is the social services or the Medicaid managed care plan. They now have to basically document, and their determination on, if they decide to deny or discontinue the services. And for those reassessments, if it's done within 12 months, then a new physician order is not going to be required. So that is a positive. That's just one less appointment that you guys will have to go through. And with this program, there's been I could say definitely a very lax approach to the designated representative and oversight with that. I've had some designated representatives where they've lived in other states and they were, tasked with managing the program for the consumer. So really what Department of Health is trying to do with this last change here, they're trying to make sure that that these designated representatives are available for those assessments and visits, and that they're actually aware of their responsibilities, which again I feel is a good thing because this program could be dangerous if the consumer has a designated representative that has no idea really how to manage this program and doesn't really know what's going on. So I think this will make for a safer, and really better experience for the consumer if the designated representative is present. Maybe not. They don't have to be present every time the care is provided, but at least be there for the assessments and really kind of have an understanding of what is going on. And that concludes the presentation. And we have some of our contact information here. We can you can even reference some of our social media. We have a lot of information there, and we are going to try to, if we hear anything, we will definitely send it out to you guys via email, and we're going to share this PowerPoint with you as well.
And I really can't speak highly enough about our social media platforms. I'm sure a lot of you even heard about this workshop through our social media platforms. We really pride ourselves in it being educational and informative, and we're not trying to sway people one way or the other, whether it's with the licensed home care services or CDPAP services. We really just like to educate everyone with what the options are for them. So I really encourage you to reference our website, reference our social media. We will also be promoting any other upcoming virtual workshops, and in the future, hopefully in-person workshops. And I definitely recommend that you email either myself or Joe with any recommended topics that you want to hear more about, whether it's differences between personal assistance and home health aides, what they can and what they can't do, what are the differences, or the differences between the licensed home care agency and CDPAP. There's just so many topics that we get requests for, but we really want to see what the demand is. So feel free to email us with what you want to hear about.
Awesome, and please, if there's one thing to take away right now, the most important is, just make sure that you know your rights when it comes to, if you come into the situation where your fiscal intermediary is not approved to continue services, know that, you can choose, you can remain in CDPAP, and you can just go to another fiscal intermediary. I really don't want to see people being forced into programs that are not going to be beneficial to them. So, if you have any questions, you can feel free to contact us about that. And I hope that this was informative for everybody. Whether you're just starting your CDPAP journey, or if you've been in the program for many years, I hope that this was able to inform you about some of those changes. And I hope you stay safe, and we will definitely let you guys know on the updates, and have a great night. Okay.
Bye, everyone.